A 7 year female presented to the ophthalmologist with the bitemporal hemianopsia. MRI of the patient was ordered on the second visit, and it shows the pituitary tumor. Which of the following best describes this tumor? So the option A is pilocytic astrocytoma, option B is ependymoma, option C is medulloblastoma, option D is supratentorial tumor, and option E is glioblastoma multiforme. So the scenario is of a 7 year female, which is a child, and it presented with the bitemporal hemianopsia. In children, we know that the infratentorial tumors are more common, and pilocytic astrocytoma, ependymoma, and medulloblastoma, these all are infratentorial tumors. But it is also written over here that this is a pituitary tumor. This is a pituitary tumor. So pituitary tumor lies above the tentorium cerebri. So it is a supratentorial tumor, not an infratentorial tumor, because the infratentorial tumors lies below the tentorium cerebri. Okay, so the option, so knowing all these scenario, these may not be correct, although the pilocytic astrocytoma is more common in children than the ependymoma and then the medulloblastoma. Over here, the option D is supratentorial tumor, so we could consider it, we can consider this option, and the option E is glioblastoma multiforme. So the glioblastoma multiforme is a tumor of astrocyte glial cells, and it is more common in the adults, not in children. So the correct option is option D, because it is a pituitary tumor and most likely it is a craniopharyngioma, and this is the only supratentorial tumor in the children or young adults. Now let's coming to some additional points over here. That is, infratentorial tumors are more common in children. Yes, we have already discussed it. In children, most common tumors are pilocytic astrocytoma, then the ependymoma, and then the medulloblastoma. And these all are infratentorial tumors. It can be remembered by the mnemonic PEM, P for pilocytic astrocytoma, E for ependymoma, and N for medulloblastoma. This point shows the scenario of the question is a craniopharyngioma, which is only supratentorial tumor in the children or young adults. Craniopharyngioma arises from the epithelial remnants of Redke's pouch, and Redke's pouch give rise to the anterior pituitary. The bitemporal hemianopsia is due to the compression of the optic chiasm, and the optic chiasm containing the nasal fibers from both the eyes, affecting temporal side visual field. So we could discuss in these pictures. Okay. Wait a moment. This is the floor of the mouth, and this is the base of the brain. From the base of the brain, from the diencephalon line, the posterior pituitary arises, while from the floor of the mouth, this Redke's pouch arises, and it migrates to its site of anterior pituitary. It will form the anterior pituitary. Over here, you can see that this Redke's pouch has been dissociated from the floor of the mouth, but there are remnants, the epithelial remnants of the Redke's pouch, and these remnants give rise to the craniopharyngioma. Okay, so this is what we have discussed. Now, the compression of the optic chiasm. So this is the pituitary gland. Sorry, this is the pituitary gland. Whenever a tumor arises over here, so it will compress this area, and here is the optic chiasm. So this optic chiasm will be compressed, and this optic chiasm compression will cause the bitemporal hemianopsia. Let's erase all these things. Okay, so that our field is clear. Okay. Now, sorry. Now let's coming to the last picture. So this is the bitemporal hemianopsia. Over here you can see this is the bitemporal hemianopsia, and the compression occurs. Wait a moment. And a compression occurs over here. This is the optic chiasm. These nasal fibers are affected, and these nasal fibers are affected, while the visual fields are affected are bitemporal. This is the temporal side. That is this one and this one. Okay. So this is what it has been discussed, that the bitemporal hemianopsia is due to a compression of optic chiasm containing nasal fibers from both the eyes, affecting temporal side visual field. The glioblastoma multiforme, that is the astrocytoma, is a supratentorial tumor, and it is most common in adults. The tumor marker for glioblastoma multiforme is GFAP, and it has poor prognosis. The supratentorial tumors are more common in adults and neonates. Adults and neonates. So this is all for this MCQ. Stay connected with us for discussion of other MCQs. Thank you.